Hello, everyone. I'm Darlene Young from Arlington and Outreach Coordinator at CAT TV. I'd like to welcome you to another segment in our program series, Mindful Health Alternatives, that appears here on CAT TV monthly on Channel 15. The goal of the series is to introduce you to a less stressful lifestyle through several different methods. Our guests today are from the Bennington Rescue Squad, and they are both AEMTs. To my immediate right is Elena Noblet, and to her right is Joanna Zabo. Welcome to both of you. I'm so glad that you're here. They're here from a program from the Bennington Rescue Squad called Fallscape, which is a falls prevention program that Vermont emergency medical technicians are being asked to take a proactive part in. And they are working throughout Bennington County. So they're here to tell us about it. And it's a program that actually I'm going to give you a little bit of background about, and then I'm going to let the girls tell you about. Did you know that Bennington County has the highest fall rate of adult individuals age 60 and above? I was shocked to hear that. I mean, it was just like, oh, heavens. And according to statistics, starting in June of 2015, the Vermont Department of Health, in partnership with the National Council of Aging, is participating in a grant program on reducing falls in Vermont, funded through the National Administration on Community Living. And emergency medical services, such as the Bennington Rescue Squad, are collecting and utilizing data to provide client-centric, evidence-based information to high-risk population. Now, in 2010, 120 Vermonters aged 65 and older died as a result of a fall. In 2009, more than 1,600 older Vermont adults were hospitalized, and additional 5,023 were admitted to the emergency department due to falls. And in 2013, emergency medical services data showed that there were 997 lift assists where a client called 911 because of a fall and they couldn't get up. So they called 911, called a rescue squad because they fell down and they couldn't get up. They weren't transported, but the squads responded to the incident and had to help them up. So this fills the gap of falls, and they, went and helped them up. And here in Bennington County, the greatest number of falls were found in all of Vermont. So ladies, welcome, and tell us about your program.
Thank you. So our program did start, we started working with the Vermont Department of Health back in June of last year based on the grant that they had received. Vermont has the highest number of falls in the nation, and Bennington County has the highest number within the state of Vermont. So the health department recognized that we really needed to start being proactive to decrease the amount of falls that we're having in our state. One of the reasons that we may have the highest number of falls in Vermont is because we have a very high elderly population compared to some other states. So that may be a factor as well. Also, now that the health department is working with EMS in implementing this program, we'll be able to gather more data and information on our falls. All of the falls in the past were reported by primary care doctors. Currently, now they're also being reported through EMS. So all of those falls that were lift assist were not part of the database. And since this program, they are part of that database.
Okay.
So initially it will bring the number of falls up since we're reporting more.
Okay.
But then we will be seeing a decline in those falls.
Okay.
Another thing we're working on is when people fall, reducing the injuries from their fall. So just some interesting information is so far since June of last year, we've reduced falls in our county by 50%.
Wow.
using this program, and another 50% of those people that were falling, injuries were reduced. So it's great.
That's good. That's
Yeah,
good.
it's really great.
So, why do you think people fall? I mean,
So there's plenty of reasons. You want to answer?
Sure. Some of the reasons that people fall, it can be a simple thing like their vision,
okay.
their medication, um, their diet, even because if they're not healthy eating, they're weaker. Recovery from a previous injury, their lower body weakness,
Okay.
things like that. So we can go in and help them to really come up with the idea of what they can do to improve their lifestyle. We don't want to go in and necessarily say you should do this, you should do that. We want to educate them and let them make the decisions as well, because it's for long term. It becomes another way to begin a new lifestyle
Okay.
of care. We even go in and resituate people's apartments and homes, such as moving a bedroom around because it was cluttered, and we really haven't had this particular person fall since.
Really?
So yeah, little things like clutter and when you age, you don't have the strength to go around and clean your house like you used to. So we can put them in touch with other services as well.
Okay.
So that eliminates some of the reasons they fall.
Okay. So, say that a person, fell because of the way the house is situated, like, like the way it's laid out and stuff. And so you would do like an intake application or something like that.
We make notes and we do a lot of observing, and most folks are really, really good about letting us go in, like look at their bathrooms, for example. Do they have grab bars? Do they have the raised toilet seat? Do they have a bathtub or shower that they can manage on their own? Do they already have programs that come in and help them get their meals and bathe and do simple things like make their beds and pick up some of the clutter? Some folks have pets. And one of the things I found that they're a little bit afraid that, oh, I didn't trip over the dog. That's not why I fell. So even putting the dog or the cat's food in one spot and keeping it there instead of where we go in and notice that they have things, we just try to improve on them. So, yeah, things like that work. We
that's
actually
good.
put grab bars on for one gentleman because it was a mobile home, so it had to be reinforced, and we have some volunteers who help us do those types of things, or should I say we volunteer some people to do those things, like husbands.
Yeah,
But it works. And,
That's good.
Yeah.
So
yeah.
this is like through a grant that the Fallscapes has gotten, or
She can
Yep.
talk to you.
So the state of Vermont Health Department received the grant, and we've also, Bennington Rescue has done some fundraising on our own to collect some funds to help pay for uninsured medical expenses. So what we use those funds for is to help purchase grab bars if insurance isn't able or willing to pay for a grab bar or a cane, walkers, things like that, or there's a portion of that that isn't covered by insurance. We have a small amount of funds that we've raised through fundraising that we can help the patients buy that equipment that they need.
good.
We've also had people volunteer, carpenters volunteer, and put in the frames for the grab bars to actually go into. We've purchased other items or supplied other items that some of us have already had in our own homes, like
Oh,
what
the
is that?
non-slip stuff you put under rugs.
Okay.
Yeah, because simple things you'll find out they're falling because the rug slides,
Right.
and it's really a simple solution.
And we've used it on a bed, actually, between
Yeah.
the mattress and the
Box
box
spring,
spring to help the mattress from sliding. There was one patient who the bed was sliding when she was getting out. So it's really just identifying, risk factors and things, behaviors that would happened to cause a fall.
That's a really great idea about, like putting it under the mattress because, you wouldn't have even thought about that, and it saves, from the mattress going sliding right off the box spring. That's really, really good. That's good. Now, so that takes like the accessibility in the home and stuff, like food and clothing too. Can you put them like in touch with, like if they need like clothing and stuff, like Goodwill or something like that, and help them there, and medications, like if they're taking like muscle relaxers or something like that. I mean, would you talk with their physicians or something like that and get them on different programs or?
Yes. So initially when we go in, what happens in our program is we get a referral
Okay.
for a patient to participate. It can come from a doctor, anybody in the health field, family member, the patient themselves can refer themselves. So we also get a large portion from EMS. So any of the falls that we go to, those patients we reach out to them a couple weeks after their fall to offer the program. So what we do is we set up an initial interview where one of our Fallscape providers go to the patient's house.
Okay.
So during that interview, we talk about the falls that they've had, near falls, so what they've done to protect themselves from falling. We go over medications. We review the medications, make sure that we use a vial for life so that we're able to track those and have medications and medical information available for if EMS is called to that patient's house. If we find that we have some questions about medications, we do call the primary care doctor, and they're able to work with us with that. We've had patients who are on medications and the physician had decreased medications, so we were going and just doing blood pressures every week, really following up with people who needed to do their blood sugar on consistently. So it's a lot of working with primary care doctors and other agencies. We give a lot of referrals to SASH, Meals on Wheels, Council on Aging, things like that. We've had to do a lot of training ourselves on what is out in our community for services.
Okay.
And there are a lot of times where we give referrals out to other agencies, and sometimes they have those services in place, and we're able to connect and share information with those services if the patient decides that would be a good idea. So we may be able to talk to SASH. We'll call them from the patient's home with the patient and try to come up with a plan for, we did that for a situation for a bed rail for somebody who was rolling out of bed.
Okay.
Okay,
just two things quickly before we go further. Vial of Life, I know what it is, but maybe some of our viewers don't know what the Vial of Life is. So can you just explain that? Because you've given them away at Mayfest, because I've seen them there. So can you just tell our viewers what the Vial of Life is?
Sure.
Please.
We record their medications for them. It goes inside the vial.
Okay,
That looks
sort of like
a
a
pill bottle.
a pill bottle, okay.
Larger pill bottle.
Yep.
And a magnet goes on the refrigerator so that when EMS or anyone walks in, someone checking on the patient can see that they have that list. It also includes who to contact.
Okay.
A brief kind of medical history.
So the vial itself, the pill bottle, is in the refrigerator?
It's in the refrigerator.
So there's a magnet on the outside of the
Yes.
refrigerator that says, please look in the refrigerator, and this pill bottle is going to be in there with this information.
There's also a sticker that goes on the entrance to the home.
Okay.
So as soon as you're walking up to the home, you have some idea what you're going to find, that there's some help there for you. Especially if you have to be let into the place, EMS or the police or whoever key holder is letting you in, that we can go directly, if the patient is there to help them, go directly to that and get some idea what may be going on. So it is helpful, and it helps them organize it too, instead of having family members going, what do I do with the list? I know they are on medications, but they just changed one. So we also update it as we go back for visits.
Okay.
or they report back to us that they've had changes.
Okay. So this program will air after Mayfest. So if you don't have a vial of life, so that you have your medications listed or your primary care physicians listed, so that if you ever have to have the rescue squad come to your house to bring you to the emergency room or whatever, you can get in touch with the rescue squad and get one of these vials of life, and record your information so that it will be there for your family. So they're just a call away, or you could like walk over to is it McCall Street, and get
McKinley.
McKinley, excuse me, sorry about that.
That's okay.
So you could go over to McKinley Street and get one during open house, or just drop by and get one. Okay, and the other thing that you referred to is SASH. I'm not sure of what that refers to.
SASH is support and services at home,
Okay.
and that their program is intended to help patients stay in their homes.
Okay, and what agency is that through?
That's the name of the agency.
Okay.
Is support and services at home.
Okay,
So in Bennington, they have Corby Apartments.
okay,
They have the Walloomsac Apartments, Brookside Apartments. Am I missing any in Bennington? Oh, Homestead Mews and
Homestead,
Homestead
yeah.
Green.
okay, over
Those
North
are-
Bennington.
Yep.
Okay,
And they have residents in Manchester and those areas. They're not apartment complexes, but there are homes in that
Okay.
area.
okay,
So they help those patients. They have mobility, handicap accessible,
okay.
all of those things. They also check in with the patients and help them.
They kind of help them relate to other people and get what their needs are across to the right resources.
And also check on their well-being and stuff like that.
Absolutely.
Okay,
And
good.
they do.
Okay.
They have nursing staff.
Oh,
So
good. Okay,
that's-
because I'd never heard of that
Yeah.
Before. So good.
Yeah.
Okay, very
Yeah,
good.
they do
Okay.
programs. They also set up transportation to different programs for their
good.
residents. So
Oh, good.
Yeah.
Okay, very good. Thank you.
Yes.
Thank you. Okay, didn't mean to interrupt you,
Oh,
but
no, that's
I'm
fine.
just thinking like, okay, I'd never heard
No,
of that.
absolutely.
And it's like,
Yeah,
and I
That was a
knew-
new program to us as well that we weren't familiar with.
Good,
So
okay.
it's great to learn of our resources.
Yeah,
learn
yeah,
about the
because I know
resources.
that many of our viewers probably had never heard of that one, and the Vial of Life. Like I said, I knew, but some people out there probably
Yeah.
didn't know.
Yeah.
Okay, good. All right, good. All right, so balance and gait we've touched on. Vision, folks have problems with their eyesight all the time, and we have to be mindful of that as well. Medications we've talked about. We've also talked about the environment. Chronic conditions. What are we going to do about like diabetes and stroke, arthritis, inactivity, depression?
And that's probably our biggest number. So you would think it's the environment, but with our program, it's really focusing on behaviors and behavior modification. So we don't want these patients falling at home. We can change their home environment. We can't change other environments that they may be going out to a grocery store, those types of things. So it's really helping them be aware of their surroundings, as well as being aware of their abilities or disabilities and how to work with those, with what they have, to maintain their lifestyle, or we have patients who are really fearful of falling, so it prevents them from going out places. And we really want to increase patients' quality of life. We want them to be living and doing the things that they enjoy. And so a big part of it is we find patients who have depression because they've been in their homes and not going out. a lot of patients with diabetes, and what we can do is keep encouraging them to, follow their medication schedule, take their blood sugars.
One of the things I found with people with like diabetes, for example, is they will sometimes tell me things that they haven't told their visiting nurse.
Really?
And I don't know if that's fear on their part of maybe suggesting they may not be in their home much longer. But when they communicate that with me, I can communicate that with their visiting nurse. And several times I've been introduced to their visiting nurses. They come in while we're chatting, and it's nice because the three of us can sit down and talk. And that has improved relations between the three of us. It's really given people the courage to speak up on their own behalf, so to say. It's so they're not just keeping things to themselves. They're learning how to communicate for themselves better.
Yeah.
So there is a huge fear of coming forward and talking about falling for patients. And I think the big fear is, being taken out of their home. So we found a lot of patients were not reporting their falls to their primary care doctors. And with us, EMS doesn't necessarily have the control to take a patient out of their home and place them in a nursing home. So some of that fear is gone. But what we've also done is really collaborating, working with home health, primary care doctors, any other agencies that the patient is receiving to help that patient kind of voice their concerns, as well as cover all areas of their care. So it's been a lot of collaboration and people really working together as a team.
Yeah, that's good. I mean, it just seems to, work so much better if you can work together as a team. And like Joanne said, like they might confide more in you than somebody else that they see all the time, because maybe it's not a trust issue, but maybe you'd be more sympathetic or something, or listen differently than somebody that they see all the time, So it's good.
And some of it is not having the ability to deny the fall because we've been there to help them up.
Yeah.
So that takes away a piece as well.
Yeah.
They don't have to admit to falling because we already know.
Yeah. What is, how do I want to say, what do you feel is your biggest, your biggest concern when you see these people? Like, what do you see a lot of?
What I've seen a lot of interviewing at home is fear. Fear itself. A lot of people have the fear of what's going to happen beyond this year. I've noticed they don't really necessarily live in the moment that we're in and take care of these situations. They always look ahead. They're going to get weaker. Their vision's going to get worse. What's going to happen to me? Well, we're here to improve that, so you're going to get stronger. And that's actually one of the questions. Do you feel that you can become stronger? And delivering a positive attitude, yes, you can. And I've had them say, at my age, how do I become stronger? And simple things like just simple exercises and keeping their mind alert, puzzle books, word searches. So it gives them hope instead of that fear. And it encouraged them to live a higher quality of life. That they had a great quality of life, and they've kind of had a setback, so to speak, when they've fallen. And so it creates this fear.
Yep.
And when we go in and we have a positive attitude, you can become stronger, and this is how. They have something to look forward to alone is sometimes enough to build on.
Right.
That if you think I could get stronger, then I can.
Yeah.
So
That's good.
the fear has been the greatest thing I've seen.
Elena?
So that's my big thing that I love about the program. My background is psychology and counseling. I work as a therapist, so we use motivational interviewing as part of this program, which has been really huge. Like Joanne has said, really telling the patients what they're doing good at focusing on positive, giving them reassurance, and then helping them build themselves back up.
That's good. That's
Yeah.
very good. Now, with a lot of different programs and things, do you find that there are people that fall through the cracks? I mean, in a lot of things in society, there are people that have insurances, and insurances will pay for certain things, but there are things that insurances won't pay for. And there are people in our society today that do need help, but they're not covered for things, and they're afraid to ask for help because they know that they won't be covered by.
Absolutely.
So, can your program help them?
I think it can. I think it can because we're a very determined group, and if there is a way, we will find a way.
Okay. Because I don't want John Q. Public to stay away because they are in danger of falling and they have issues. And I don't want them to stay away from being helped because they're afraid that they will be denied the help. Do you see where I'm
do.
going?
So the program is a 2-year grant, and part of that grant is offering these services are free for all of the patients.
Okay.
So anybody who is participating in the program does not pay,
Okay.
and we do not charge or bill insurance. It's all a completely free program.
Okay.
So there's currently the state is asking for an extension on the grant, so we will still have another 2 years working under that where there's no cost to the patients.
And
So that's
we're
a
gonna
great
continue
thing.
our fundraising efforts too, if there's things they need. And we work with a great bunch of people too.
Okay.
I've had a group of on-call when we were in downtime go up and actually help. So 6 of us loaded up a couple ambulances and went up and changed this woman's apartment around.
So we did.
And things like that. We have people that are willing to volunteer their help.
Okay.
Yes,
Good.
absolutely. We've had a lot of people volunteering. Some of them are our fellow employees at Bennington Rescue, volunteering their time and going to patients' houses and rearranging furniture. And of course, that was at the patient's request. We don't go in and tell people we need to change this. The patient decides, and then we help them do what they've decided to do. So that's been
It
a
opens
great
up an
part.
avenue of community. You know what I'm saying? It opens up that whole avenue where people hear that we're helping, and the
And they want
patient will tell their neighbor, for example, and their neighbor will come over and say, that old sofa's got to go. And they'll move it. And we go in and, oh, who moved that? Well, my neighbor. I told him about the program. My neighbor helped.
Well, that's
Yes.
good.
So
That's
it's
very
a
good.
snowball effect.
Yep.
You know,
That's
it really
very good.
is.
Right. So we've
Now-
applied for other funds.
Okay.
Yesterday, maybe it was earlier this week, we received some funds from Price Chopper that we had applied for.
Oh,
So
good.
Price Chopper has given us an amount of funds to
Good.
help with some expenses.
Very good.
So yeah, we just keep reaching out because we really want this program to be accessible to as many people that are willing to be in the program.
good.
So there are still patients that slip through the cracks.
Mm-hmm.
We can't force anybody to participate, and some people aren't quite ready.
Yep.
So I don't know that they're slipping through the cracks or they're just not there yet. They have to be an active participant in the program.
Now, when we talked on the phone, you and I, when we were setting up the program, just because you're Bennington Rescue Squad doesn't mean that it's just for Bennington area people. We talked about Manchester and the area a little bit beyond Bennington and Arlington and Shasberry. So do you want to sort of like spread out and tell where you can cover?
Sure. So different than the Falls Prevention Program is a separate program from the EMS side of things. So the EMS side of things, we respond in Bennington coverage area for like 911 emergency calls and do the transfers that are within our coverage. So with the Falls Prevention Program, we are working with the state health department who's covering the entire state. We're offering this program to the entire state. So Bennington Rescue covers up until Wilmington. Deerfield Valley Ambulance participates in this program as well. So residents over there can reach out to Deerfield Valley. We cover over to Williamstown, Massachusetts, Hoosick Falls, New York, and then up to Dover, Danby area. The closest agency heading up north is Rutland Regional participates in the program. So we're really just kind of breaking up the state as far as coverage areas. People who are being referred do not need to know which agency. They don't have to know what coverage area they live in. We all work together and decide, I got this referral, but it really belongs to Deerfield Valley, and we just send the referral to them.
Okay.
So we're just working at this point to cover anybody who wants to participate and needs to be part of the program.
So if someone wanted to become part of the program, how did they get hold of you?
So currently they can either call Bennington Rescue, so the 442-5817. Our extension is 122. We also have a website that is www.benningtonrescue.org, and on the home screen to the left there's the fall prevention program link. We also receive fax. There's referral forms on our website that people fax. Our fax number is 802-447-1993. So those are really the ways that we're receiving referrals. We can receive referrals anyway.
Now, can
The
a
easiest
person refer themselves, or do they have to? Okay. Okay.
I've even had, when we go to one patient, they'll refer a friend right there.
Oh,
My
really?
friend could really use you.
Sure, I'm going to refer myself and my friend too.
Yeah.
It's like good.
Yeah.
Good. Okay. So, what else would you like to share about the program?
Well, I think it's important to know that not only do we go out and help the community, but they in return give us a lot of information back. And I've learned of several other agencies from some real go-getters who want the help, and they're going to research. So they'll educate me a little bit as to what's out there for programs too that I've never heard of. So it's a community-wide thing, and it's been beneficial all the way around.
It's good.
Yeah, to keep people home, keep people safe.
Everybody share with
Yeah.
one another, and
Yeah.
everybody does everything.
Yeah.
It's good.
Yep. And so we are also working with SBMC,
Mhm.
and so they are aware of the program. They'll be giving referrals, and when we bring patients into the ER, we let the staff at the ER know that this is a patient with a falls risk. So that can also prevent, as staff is aware that patients are a falls risk and are participating in the program, that they can really assist that patient within the hospital system as well, decreasing the falls,
Very good.
as well as not doubling referrals. So it's a good thing. Everybody really working together is probably really increasing and giving our patients the best possible outcome.
This is so good, and it's like, like I said to you in the beginning of the program, it's just mind-boggling, to look at the statistics, and it's like, it's just it's amazing, and sounds like a really, really good program, and you're doing really good work, and it's amazing, and thank you for doing what you're doing. So.
You're welcome.
And thank you for being with us. And
You're welcome.
And if you would like to come back and share more with us, I'd really appreciate it. So,
Sure.
and good luck with your program and with your good news coming up. I understand that you're having a surprise in the future, so that's good. So, well, I'd like to thank you for tuning in and being with us today, and enjoying the information about the Fallscape program that the Bennington Rescue Squad is working with in conjunction with the Vermont Department of Health. And if you have any questions, be in contact with the Bennington Rescue Squad at 442-5817 or go to falls@benningtonrescuesquad.org. So we hope to see you again for Mindful Health Alternatives. And if you have any questions, feel free to contact me, Darlene Young, at CAT TV, 442-8868. Thank you. Bye now.